Welcome to our latest charity webinar, which is co-hosted by Kingston Smith and Quilter Cheviot. This session, we're exploring impact measurement. By way of introduction, I'm Charles Mesquita, a charities director at Quilter Cheviot and a proud trustee of RL Glasspool, Bowel Research UK and Prism the Gift Fund. I will be moderating this session, and I'm joined by John Franklin, who is the chief economist at Pro Bono Economics. Before moving into the charity sector, John worked for 13 years for the Government Economic Service, where he helped to assess government initiatives and projects to estimate their potential impact. So is highly qualified to talk about the subject. For those of you who haven't come across Pro Bono Economics, they are a charity and their mission is to empower the social sector through economic and to increase well-being across the UK. It was founded in 2009 by Andy Hallidane. For those of you who don't know who Andy Hallidane is, he was the chief economist for the Bank of England, and it has as its chair no less than the former cabinet secretary, Lord Gus O'Donnell, who I'm sure all of you will have heard of or come across. The other panelist we have is Karl Leathem, who is Director of Impact at Kingston Smith Non-Profit Advisory. Karl is an advanced practitioner in social value and impact measurement. Karl has been instrumental in developing social return on investment in the UK, created an assurance system used internationally for impact reporting and practitioner accreditation. Karl has considerable experience, as you can imagine, helping charities engage with the various aspects of impact methodology. So again, another highly qualified member of the panel. And then last but certainly not least, we have Emily Crawford, who is Head of Innovation and Impact at RL Glasspool. Emily has worked in the social policy research for over 15 years. Her areas of specialism include financial resilience, health and social care, welfare to work, and food security. In recent years, her focus has been focused on evaluation and helping organizations to understand their impact and improve delivery. And as it happens, she has recently joined RL Glasspool to do exactly that and to guide the trustee board through that very thing. So I think no doubt we'll be sharing some of those stories as we go along. I must admit, as a trustee, impact measurement has been a conundrum in the respect that you could take the view that actually why do we bother? We're doing good, so it doesn't matter. However, I think there is no doubt that charities are better if they define impact. Their voices will become more powerful through both advocacy, demonstrating the proof, and providing effectiveness and increasing ability to raise money. But for the majority of organizations, and certainly for the ones I'm involved with, it is not a simple thing to resolve, and it's certainly not a binary affair. So with no further ado from me, let's kick off, John, with you. I think, what should charities be thinking about when it comes to looking at measuring impact?
So measuring impact can mean quite a lot of different things. There's lots of different approaches. There's lots of different ways that you can talk about impact for an individual charity. So I think our starting place for this would always be to ask why. Why is it that you're measuring your impact? Who is it for? Because that can range across from helping to address concerns from trustees, helping to raise funds. There might be specific funders who have very specific interests that you're trying to address. Or, I mean, ultimately, what we would encourage organizations to do this for is to try and drive improvement in terms of efficiency, efficacy of what they deliver, and using impact measurement to drive that. But each of those different needs will have different approaches, different techniques that will be most appropriate. They may have different outcomes that are of particular interest. So really asking that first question of, why are we doing this? Who is it for? Who are we trying to influence? How are we trying to influence them? And that will help you figure out what type of impact measurement would be most appropriate for you, whether that qualitative, quantitative, whether it's economic, which is what Pro Bono Economics specialize in. There's lots of different approaches, but start with that first question of why.
And Karl, same question to you.
Yeah, what John says is key, actually. The starting point would be why. I think if I was faced with a group of trustees or senior management people, and they were asking me this question, one of the things I'd be saying is, well, look at the landscape, look what's out there. And make sure you tailor what you want to do with the clear reason for doing it. If we just briefly look at the landscape, for example, you can do stuff on a macro level. And You know, you can study interventions in an economic sense. I suspect quite a bit of what John's expertise is in that particular area. And so some of this stuff is really useful for public policy and so on. So if you were to look, for example, at the benefits to society of tackling social problems like obesity, that sort of thing, it would be very useful for public policy and governments and society in general, you know, to know that, you know, obesity costs, for example, in the UK, 27 billion every year. So really incredible, useful stuff in terms of informing policy. There's another thing, though, that is kind of more akin to what we do at Moore Kingston Smith, and that's looking at stuff on a micro level. So if an organization similarly is dealing with a social problem like that, the organization probably wants to drill down into exactly what it's achieving in a much smaller scope, in a sense. So you might want to be looking at what are you achieving for your particular constituency, your group of stakeholders, including your intended beneficiaries. You know, some of the things I would be saying is be very clear what your activities are, who your intended beneficiaries are, and don't forget other potential people who will be influenced by what you do in terms of, you know, other people, other state agencies and so on. If I was to come up with the elements that are really important, you know, and try and sort of squeeze it down into something, you know, quite snappy, I would say what you need to do is figure out what changes as a result of your activities. For whom do those changes take place? For how many of them in terms of the people you have contact with? How much change takes place? So, you know, what's the distance traveled in terms of stuff that you're responsible for moving on, and at what cost? And so when you have that suite of things together, those are the key elements that I think will then allow you to sort of take decisions.
Brilliant. Thank you, Karl. And Emily, have you got anything you'd like to add?
Yeah, absolutely. I couldn't agree more with both John and Karl, both in terms of, you know, the fundamental question of why, and also then kind of using that to understand the data gathering process. I would probably even take a step back and more profoundly ask why, in the sense that embarking on an evaluation process to understand impact is very much about understanding why we, as the charitable and community sector, are here. What are we here to achieve? We've all been set up by our founders. You know, some organizations, you know, can track back to the medieval ages. So we have to think about, why are we here? What were we set up to do, in order to then inform an evaluation process that then proves that impact, that effectiveness, the change, as Karl said. What is the change that we have achieved? What can we track back that through our own actions we've achieved for our beneficiaries? But ultimately, all of that is data that points towards, are we achieving what we are here to do, our purpose? And I always like to think of that as kind of understanding what good would look like at the other end, and having that collective sense of what does a good outcome look like. So for me, when charities think about evaluation impact, there are two watchwords: purpose, why are we here, and process, how are we going to figure out whether we achieved it. So they're my two go-to words, which, Charles, as you'll know through my communications with our board, they are the words that I will be beating you around the head with as we go along our process of evaluation framework.
And you've been doing a very effective job with that so far. So I know there's two watchwords. John, you raise about quantitative and qualitative. So when should an organisation look at one rather than the other, or should they look at both?
There's no simple answer to this, because I think quantitative and qualitative approaches serve different purposes. So it's more about understanding what they can give you and why they're helpful. So I guess starting with qualitative, this can cover a whole host of things, right from doing focus groups with individuals that you've supported, to building case studies around individual stories for what impact your organization has had. And those can be fantastically helpful. I mean, first of all, individual stories are a great way of telling the kind of message of what you're all about. It kind of pulls on the heartstrings. It can be really effective for both communicating what you do to other people, communicating with potential funders, be they, you know, private individuals or large funders as well. I think focus groups are fantastically important for understanding, I guess, how what you're doing is work, and can give you really immediate feedback on those processes. So what you're doing on a day-to-day basis, what's working about that, what's really important about that to the people you're supporting, but also what isn't working and how you can tweak those processes to drive improvements over time. I think the challenge with qualitative stuff is it's great to have lots of positive stories that tell you that you're doing good things, but at some point somebody will ask the question, well, does this intervention, which you've got lots of good stories about, give you more benefit than this intervention, which gives you, which you've got lots of other really good stories about? And I think that's where the qualitative kind of reaches a bit of a limit of what it can tell you. You know that there's lots of good things going on, you know why it's working, you know how it's important to people, but making those judgments of, well, is this one better than this one? Should we be putting our money over here or over here? That's really hard to do on the basis of qualitative assessments alone. And that's where I think the kind of quantitative side, where you're using kind of more rigorous outcome measures, which you can apply to a bigger group of people, potentially get more information and start to make some of those comparisons really come into their own and can inform those decisions. But I guess ultimately, ideally for most organizations, you want to use a bit of both, because both of them have lots of value and both of them are really important. And I think an example of a charity that I've seen that has done this really well has been Magic Breakfast. So they provide breakfast clubs at schools which have a high proportion of children coming from disadvantaged backgrounds. And I mean, if in terms of the qualitative, if you ever hear the story of how they were founded from Karl McConnell, their founder and current chair of trustees, she is it's such a kind of powerful, emotive story that you hear about the impact that it had and what drove her to introduce it. That's kind of really great example of how a story, a qualitative story, can really tell you what they do and why they do it. And she's a fantastic speaker when she talks about it. But they've combined that with really building up quite rigorous evidence around the impact that they have. So they worked with the Education Endowment Fund to demonstrate the impact that they have on academic attainment for children in primary schools. And actually, we've done some work with them looking at the economic impact, which kind of comes out with figures like, if the impact persists from that at age 6, actually they could be delivering a benefit of £50 for every pound spent on that intervention. So you get some really powerful stories on the quantitative side as well as that qualitative story as well.
Brilliant, that's really good. And Emily, what's your experience in this area?
Similarly, and I really agree with John. I'm coming from the qualitative research side. However, I am absolutely convinced of the importance of both. And I think it's the difference between understanding the impact on the individual versus understanding the impact at a broader level, whether that's at a population level or a neighborhood level or a school level. So the qualitative is amazing in tracking that journey for whether it's a 6-year-old having bagels at breakfast or, you know, as we will know, Charles, the individuals that we support are, you know, families and individuals in great need, and we provide them with household essentials. And we know that has a huge impact, and we receive thank you cards saying, I'm sleeping better now because I have bed, a bed. I feel more presentable because I have a washing machine. You know, I'm eating healthy food because I have a stove and a fridge to keep healthy food. These are really important stories of impact. And going through that structured process, which is what, you know, a large part of my day job is, to run those interviews in a structured way so that I am bringing an element of rigor and not just asking people to tell me any old thing, but actually bringing an element of rigor and seeking particular feedback is really important. However, that comparative element can be quite difficult. And as John said, that's when you really do need some quantitative stuff, because then you're saying, well, yes, Magic Breakfast is great, but what about the Rice Krispies Club? Would that be just as good? Or the Marmite on Toast group, is that just as good? We're looking to see is one better than the other. And in my experience of working on relatively small projects, it's often really difficult to prove that because they're just not big enough. They're 100, 150 people take part in some kind of program. That's just not the scale where you're going to be able to compare. However, you can use a slightly mixed method where you might use a control group who either didn't receive that support or received a different type of support. And I like to bring an element of standardization into my qualitative research, where I will ask people questions, but I'll give them definitions on a scale, so that rather than just saying, you know, when you started this program, how are you feeling in yourself, 1 to 5, and I might say 2, you might say 4, John might say 5, but none of us have a scale. So I like to bring a few definitions into my scale, so that although I'm often working in a qualitative zone, I'm giving us all a shared definition of what, you know, well-being might be on a 5-point scale, so that at least we have that shared understanding. So I'm bringing that journey and that life story, but also bringing an element of comparative rigor to it. But I'm absolutely upfront that the scale of projects I have worked on doesn't lend itself to the kind of cost-benefit analysis that John and pro bono economics would usually do.
And what about you, Karl?
From my perspective, I'm just thinking that a really good impact study will require both qualitative and quantitative data. There's no escaping that. I don't think you can choose one or the other and say that, you know, that's the research designed. The old mantra in the old days of in the early days of social return on investment, we used to say you need to tell the story and you need to have the numbers. And we used to say the numbers are no good without the story, because that provides context, and vice versa. So, you know, I can recall sort of examples where you just need quantitative data. For example, when we were doing some research and we didn't have enough of a sample of the group we needed, and we found ourselves slipping into the need to create a much more quantitative approach in terms of developing a survey and crunching those numbers as a result. And equally, I can think of an example where we just wouldn't, as the others have both said, actually, we just wouldn't have had the richness of insight without the qualitative focus group approach, albeit with those, you know, having their limitations. I can remember a piece of work we were involved in some years ago now for a school. It's in the south of England, and it was working with the most profoundly disabled children I've ever seen. Some of these children communicated by pressing a button, yes or no. And we were looking at the benefit of in community, in a small kind of village community that was created for these children. We were looking at the benefit of having their healthcare and education combined, because of course, you know, they could have a health emergency at the drop of a hat. So we were testing that from the point of view of the children. But when we talked and interviewed the parents, we broke into a whole new world beyond the care of the children in terms of what family life was like. And I can remember a woman very eloquently and very articulate talking about having 2 children and getting them in their wheelchairs to appointments on her own. Can you imagine parking the car and so on? So that took our study, that qualitative piece actually swayed our study in a slightly different direction for another stakeholder. Remember I said in the first comments I made that, you know, be aware that there may be other stakeholders that your primary purpose isn't around, essentially. But we were able to actually explore for parents how their family life has changed, improved, as a result of being able to, with the school, win the legal arguments for having this care package in place. This woman in particular was able to get back to, you know, caring for her other children as well, who didn't happen to have the disability. She had a little bit more economic activity. Family life was a bit more normal. All areas that came out that we began to look at that we would never have got from the kind of original survey approach. So I think you need both.
Brilliant. That's really helpful. And I'm going to come back to other stakeholders. But before I do so, one of the things that strikes my mind, and sorry, Emily, I know I asked this question at a trustee meeting, but when you're talking about the sort of questions you're asking, how do you remove unconscious bias? That's something that always worries me, because we all have our own very firm views about things, whether they're right or wrong. And it's just, how do you try and make sure that is the case? I don't know who'd like to Emily, you perhaps
Yeah,
you should kick off there.
sure. No, and absolutely, you're quite right to keep raising it, because we are all vulnerable to our own habits, beliefs, prejudices. Even scientists working in the kind of the deeply numerical fields will occasionally overlook data because it didn't quite fit their hypothesis. So we are certainly all vulnerable to that, particularly when it comes to those of us in the charity sector, where there are certain belief systems that are a fundamental asset of what we do. We believe in making the world slightly better tomorrow than it was yesterday, but with that can sometimes come an element of not quite prejudice, but sort of presupposed outcomes. So I suppose for me, the evaluation process and the data gathering that goes with that is the fundamental way that we avoid sort of putting too many blinkers around ourselves, because I would much rather know and have a productive conversation based on the findings of a survey, a set of interviews, a set of focus group, where we can pass that and then share it amongst trustees and senior leadership and say, hey, here's a set of data. Let's use this as a jumping off point to discuss, are we being as effective as we think we are? Are we achieving what we think we are? If we held up findings against mission, do they meet or are they parting? So it's essentially, it's a jump off point to have that conversation and allow each of us to challenge each other about our presupposed notions about what a good delivery model looks like, what our beneficiaries need. And, for those of us who are in the grant making world or the direct service delivery world, we may think that our delivery model, XYZ, we do this, we do that, we provide this. We may think that's the best thing. That may have been historically true. It may no longer be true. And it's the interrogation process that the structure of evaluation brings that allows us to just tease out those assumptions and lay them on the table for everyone to discuss and kind of then take a clear view on.
And John, have you skipped over data because it didn't suit the direction you wanted to go?
Never, Karl, never. No, obviously that's something that we will try to avoid. And I think looking at it from the pro bono economics perspective, one of the reasons that people come to us is because we are a kind of independent third party, and it avoids you making some of those judgments because we're genuinely trying to get to the bottom of what is the impact. So I think there is something there in sometimes having a third party involved to give an assessment of these things and give a more neutral assessment. I think more generally, starting from getting the basics right of, as Emily and Karl were talking about earlier, what's the end goal of the charity, and how does what you do, your activities, lead to a set of changes or outcomes that change over time for the people you're working with, that may be short-term outcomes, they may be long-term outcomes, but all feed towards that goal. I think getting that picture straight in some form of logic model, theory of change, just some basic structuring so you're being clear about what those outcomes are and how they lead to your end goal, gives you a starting place to help avoid some of that bias, because immediately you're starting from, okay, so let's be clear, these are the outcomes that we're aiming to achieve. And that's normally quite a useful process for an organization to go through. And then you can start to think about, okay, well, what are the best ways of measuring these outcomes? And one of the things that we often end up emphasizing from the perspective of doing economic evaluations, and that is a particular lens, but one of the things that we try to emphasize is using standardized, well-validated questions that are already being used out there. And there is always a bit of a trade-off between finding one that fits exactly what the charity is all about and is still validated and used externally. But often that's a great way of avoiding some of these biases, because these questions will have been pretty rigorously tested to make sure that they are reducing the risks of bias. There's quite often guidance around how you should ask them in where they should be positioned in the survey, things to avoid, which could help to you again to kind of reduce that bias. So a good example of this is the ONS measures of subjective well-being. So the Office of National Statistics have developed some standardized measures of well-being in the UK, and these have been widely rolled out across a large number of surveys. There is good guidance around how to use them. They're really simple measures, actually, so they've got a good advantage for charities. And one of the reasons we like all of this well, there's two key reasons. One is that it's pretty relevant for most charities. When you really boil it down, what are a lot of charities out there to do? They're about driving up well-being for people. And secondly, because they've been rolled out to lots of places, they're being used in lots of surveys, they provide great evidence to help you with what might have happened in the absence of the intervention. So that's kind of one of the key questions for evaluations. You can build up control groups from all those surveys that are already being asked, which can be a bit of a shortcut and a bit of advantage, particularly for smaller charities.
And just adding on to that, John, are there any other pitfalls that you would just sort of, that trustees should avoid, or people who are doing this?
There are probably hundreds of pitfalls to avoid. I would say that being clear about why you're gathering the data in the first instance, and not just gathering lots of data and not getting lost in kind of getting drawn into, well, these are the questions that a funder asked us to gather 5 years ago and we're still gathering them. Being really clear about what the outcomes are and therefore which ones you want to measure, and building measures around that, ideally using, as far as possible, pre-existing questions, pre-existing validated questions that have been widely tested. Those would be two of the key things that I would flag up.
Brilliant, brilliant. And Karl, just on, is this the domain of large charities only? I mean, what sort of size do you need to be to really start thinking about embarking down this?
Interesting question. It's a bit like the question that we've been looking for years. You know, is there such a thing as impact light, and you know, is there a way to do it? I haven't found it. If it is, it's the holy grail, and I've been looking for a long time. I think there are pros and cons in terms of the size of an organization. Obviously, you know, a large organization might be able to have a resource to tackle implementing impact measurement. That resource may be in the form of a human resource, you know, that's somebody that can be assigned to develop and train and lead the organization in this way. So that's more likely to happen in a larger organization. But that too has its disadvantages. A larger organization is much harder to get buy-in across the different echelons of the organization. So, you know, it's not the first time I've gone into a reasonably large organization and someone has said, oh, goodness me, you know, not another thing to do. And, you know, it's, you know, and we're already kind of exhausted by quality systems and all the rest of it. So you've all that complexity in a large organization and disadvantage. In terms of a small organization, I think, as I've said, there's no sort of impact light approach, but it hasn't stopped me in the past working with just very basic community groups who want to at least start the journey. And I think one of the advantages of the type of framework that we've developed at Moore Kingston Smith is that it's modular. You can start somewhere and then build up over time. So getting simple things like really understanding the difference between outputs and outcomes sounds simple, but actually, you know, lots of confusion can come from that. Mixed and confused language, you know, what do you mean by impact? In a smaller organization, it's much easier to get buy-in to a particular concept and a particular way of working. Things like not mixing your evidence. So one of the things often that can happen is that if you do, for example, a theory of change, you can easily let your hypothesis masquerade as your impact without providing the evidence at a later stage, you know. So some of these approaches that are more basic can be perhaps more effectively communicated in a smaller organization versus, of course, in a smaller organization, just the, you know, the lack of resource, certainly human resource, to cover yet another thing. So, you know, it really does boil down to needing to invest in this stuff, maybe in a small way to start with as a smaller organization, but certainly you're going to need to invest sort of resources in this, and, you know, you potentially need financial support from outside.
I mean, Emily, you've done this quite a bit as a consultant, haven't you? I mean, because trustees are always going to worry about spending money, and actually it's not probably spending the money, it's spending the money wisely, which of course you don't know at the start. What would you give as a sort of a guide from a cost basis? How would you recommend somebody, if they're starting on this journey, looks at that and starts sort of costing out what the cost of doing some impact measurement? I probably asked you how long a piece of string is, but
Yeah, absolutely, to an extent, absolutely, to an extent. And I think, to use Karl's word, it is an investment. And also, to pick up on what John said, it is about avoiding pitfalls, so that when you do invest as a small organization, as a small charity, when you invest in evaluation and impact measurement, you're avoiding some pitfalls. You're getting greatest bang for your buck by using, as John outlined, some of those really well recognized validated question banks. And as Karl was describing, you're investing in a process, and that process doesn't have to be bells and whistles and 19 levels of complexity. It can be really quite streamlined and quite minimal. But what we're trying to ensure that we do is choose the right tool for the job, know why we're doing it, and then invest in those conversations. So it's as much an investment of time as it is an investment of cash. And in my experience as a consultant, I mean, to an extent, what I would think of as a relatively small project evaluation might be somewhere between 10 and 15 consultant days. A longer term project where, I might come in at the outset, build that evaluation framework, run some workshops with the senior leaders, kind of get their evaluation tools in order, do a lot of that front end stuff, and run the evaluation and the reporting process. That might be anywhere between 35 to 50 consultancy days. Now, how much that costs you rather depends on how much you charge at a day rate. But I would say that I've done evaluations that are 100 or so people, and it's been a 10 to 15 day process where essentially I'm gathering their data that they've collected, running that and doing some additional work like interviews and kind of modeling, like getting their service model in order. Often people don't have actual diagrams and descriptions of their service model, so you need to go, okay, so you do this, then this, then this. So there's an element of that. I have found that it's a bit like, you want to kind of invest to save. So often getting an evaluation person, whether that's someone in-house or an external consultant, which I was for many years, to come in and just get your evaluation framework and tools in order saves you time at the other end, and it makes sure that your data is spot on for analysis. I had such a drama maybe about 18 months ago, just before the pandemic, where I came in to do a final evaluation of a relatively small project, and out of about a 12-day project, I think I spent 4 of those days just sorting out their 4 spreadsheets, which contained their feedback from their beneficiaries, their service users. The questions were inconsistent. The data collection methods were inconsistent. I had to kind of try and mesh these Excel spreadsheets together. And I mean, look, honestly, I would not put my hand on heart and say that was a robust and rigorous evaluation. I really did my best, but had I been involved at the front end, that situation would be far less likely to have occurred. So they would have saved a bit of money at the front end if they'd involved me.
It does show, doesn't it? If getting somebody who knows what they're doing to structure it correctly at the start has a huge cost benefit going forward. John, I don't know about you with the Breakfast Club, but I mean, they've obviously spent a reasonable amount of money. By the sounds of it, they got a funder to actually do that for them. But the actual long-term benefit, I mean, I look, sorry, at Glasspool, we've distributed something like 25 million over the last 25 years on an increasing basis. And actually the impact we're doing is we're looking over a 5 to 10 year period. And I suspect people possibly look too short term. One of the things I wanted to pick up, and I don't know if any of you've had any experience, but I know, Karl, you talk about stakeholders. Emily, you've also referred to it. Is there any advantage, and I'm again thinking of the impact light for smaller organizations, of doing this in collaboration? And if so, how would you start thinking about that? Do you go to organizations who do exactly the same thing, or do you look at the ecosystem? Does anybody want to have a view on that? Karl, perhaps you might start off as you talked about impact light.
I think I think just picking up on Emily's point about the complexities of work and so on, one of the ways to reduce the cost and think about impact light is to think about what you can co-produce with an organization. That will reduce their costs. And it'll also give you an opportunity to actually develop something together. And, so therefore, in terms of thinking, can we join forces in a sense and make a more effective approach to this? Some of the work of the Social Value UK, for example, is an organization I'm pretty close to, obviously, and was a founder director of the original Social Return on Investment Network. They have a lot of guidance around, the whole idea of working and learning sets to do this kind of thing. In terms of the other end of the machine, if you like, and what comes out at the other end, I think there are probably complexities around jointly working with other organizations to do an overall impact piece, because there's always the danger that you're mixing up the view of outputs and the causal link between the activities and what actually happens. So
you've gone on mute, Karl.
I was waving my hands there and I clipped the keyboard. So the kind of joint approach is certainly, very attractive, but it can add in other complexities in terms of the purity of the data that you end up with.
John, do you have any experience in this area?
Not enough would be the short answer. We'd love to see it happening more, but I think some of those complexity that Karl's talked about is one of the big challenges. But I think where I think this becomes relevant is thinking about that impact light type approach that we're talking about. So is there a way of doing this more easily for more smaller charities? One of the things that we found is there are a couple of developments that makes doing more rigorous quantitative evaluation. So I'm thinking specifically around the data gathering, more quantitative side, which is where I think it is particularly challenging for small charities. On that side, there are some sectors which there are more small charities that are able to do this better than other sectors of the charity, of the overall charity industry. And I think the thing that marks those out for us that we've seen is those sectors where there is some kind of established data source, which is capturing changes in the kinds of outcomes that that sector is interested in over time on a rigorous, robust basis. So there's a couple of examples of this. If you are interested in academic outcomes for children, there is the National Pupil Database, which is an administrative data set that the Department for Education holds. They will share it for the purposes of evaluation and research. There's quite a rigorous process that you have to go through, but that provides a basis for even relatively small organizations to go and have a look, and they can track the academic outcomes of the people they've worked with, providing they've got the permission to use the data for those purposes. Add that bit in quickly, but they can track the outcomes of people they've worked with, but also try and match on a kind of analytically matched control group, so an artificial control group of individuals that looked very similar to the ones they've worked with before they worked with them, and compare how those outcomes changed over time for things like GCSE scores. And that can provide a really kind of important basis for letting small charities have access to really quite good quality quantitative work. And the same is true for reoffending rates. So the Ministry of Justice runs the Justice Data Lab, which does the same thing. It allows them to track reoffending rates for individuals they've worked with. It matches on a control group, an artificial control group, say, well, this is what happened to similar kinds of people that you didn't work with. So you can start to see that impact. And where you've got that kind of infrastructure existing, it makes it far easier for far many more smaller charities to do quite rigorous quantitative evaluation than for those sectors that don't exist. And this is where I think the kind of collaboration for those sectors that don't have this kind of infrastructure in place, that collaboration could be really important. And it might be collaboration across charities. It could be collaboration with a particular funder, making that easier for the charities they're working with to do that kind of evaluation by building in that kind of infrastructure. So rather than expecting every individual charity to go away and gather data on some kind of control group, which is clearly ridiculous for the smallest charities, it's clearly too much to ask. Actually, if a funder stepped back and thought, well, we can build this infrastructure for this sector or for people working in this region, or we can focus on outcomes where we can measure these kinds of impacts using this kind of approach, that could have real advantages. but it's not easy. I'm not pretending that it's easy, but I do think that's kind of one of the reasons why we'd love to see more collaboration.
Brilliant. And what about you, Emily? Have you done anything work with on collaboration?
Yeah, and I absolutely echo everything that John said. It is really difficult to work in collaboration, because what we're essentially trying to do is to create a comparative control group. So there's a practical element where, in order to work in collaboration, projects need to be at the same point in their life cycle so that you can kick off the evaluation at roughly the same point, ideally at program sort of development stage, and then recruitment and on into operations. And then there's just the sheer kind of, can two organizations work together? And I think we all know that collaboration requires a certain amount of dedicated investment in time to make that collaboration work. It is a job in and of itself, the collaboration. In my experience, I've only worked on one or a handful of projects where there was anything close to a control group, or more than one group involved at the same time, and that was actually internal. The project I was evaluating was similar but different to and pre-existing long-standing in-house project, and they effectively operated as the in-house control group. And one of the things I thought was really interesting in what John was talking about is, I believe the Education Endowment Foundation has as its standard model, when it runs a new project or program in a group of schools, it recruits a population of schools, and then half of them get the intervention and half of them don't. And so there's always, they just have a standard model where all their interventions have a control group of similar like for like schools and like for like students. So I think if it were possible to replicate that, I mean, Education Endowment Foundation is an absolutely huge, endowed, very wealthy organization and does really fantastic, rigorous research. But perhaps where smaller charities could leverage their networks to bring that kind of collaborative spirit. So you could think, well, we know X, Y, and Z charities who operate in our space. We're quite friendly. We operate with similar populations. Perhaps we could essentially, on an informal, kind of basis, we're going to run this project. Could we borrow a sample of your people to be our control group? Now, it's not going to be anything like as rigorous as Education Endowment Foundation, but in terms of a streamlined model where a respected database doesn't exist, and certainly for us, Charles, there wouldn't be an obvious database for where we might compare the outcomes of people we support versus some nationally held rigorous database. Perhaps that more informal model where you could essentially, on a friend to friend, peer-to-peer basis, we could be each other's control groups, on an ongoing kind of, ad hoc basis, and at least bring some of that comparative element. Because as we were discussing earlier, it's really easy to prove the value of what we do, because so much of what we do is really valued. It's really difficult to prove the value of not having done that, and actually those people might have been just as fine anyway. It's the dead weight problem, and we're not in the business of policy-based evidence making. We are in the business of being sure that what we're doing is effective. Had we not done anything at all, or had we done something different? So being a peer-to-peer control group may be a sort of a shortcut for us to bring that rigor.
Certainly seems to be, to me, something worth exploring, isn't it? Because you can share resources, you can share costs, and you can, particularly if you're starting the journey, share the experience and the lessons learned from it. Just turning to my final question, and I'm going to ask all three of you, is how should an organization look to measure success? When you start out with a project, and I take, Emily, your point about making sure you structure it correctly at the beginning, because that's going to save you money, but particularly if you've got somebody with experience that's done it. But there must be something at the end that you're looking to measure, or to particular milestones. I don't know, Karl, do you want to kick off with that?
Well, I think in terms of cost and return, a positive return is always a good thing. That's something to look at. But it can't just be about that, having established that you actually are creating social value. There's something more, and particularly it's important to the organization to know exactly where you're going and what you will use this stuff for. I suppose I would return right to the very first question right at the start of our discussion this morning. Why did you do it? So has that been satisfied? That for me would be a measure of success. Other things in terms of external messaging might be things like you can demonstrate a unique selling point to a funder. It shouldn't be the only reason you do these things, but if you've got that can be pretty useful and pretty powerful. You can describe what another type of social investor will get in return if they invest in your work, and particularly if they're interested in the changes you're bringing about. And also, as an aside, you've better positive messaging for your internal use. When I say internal use, I'm talking about your PR people who will, take advantage of anything that's positive. But for me, the success is something that's more about internal messaging, to be honest. If your staff have evidence of their achievements as a result of knowing their impact, I think that's incredibly important. And particularly if trustees and staff have a better steer on the different elements that they will need to make judgment about future strategic decisions. So if you know a bit about your impact, if you know where there's a rich area of social value to be created, what resources will you need to put into that to make sure that it's sustained? In fact, efficiency comes into this as well. So when you have these different elements, success, in my view, has been able to say, well, look, can we create the same outcomes for less? And are there other areas that we should be tackling? And when you've got different levers like our costs, your income, your impact, when you have those different levers to pull, you're in a much stronger position then to take, I would say, more effective management decisions around your sustainability going into the future.
Brilliant. Thank you, Karl. And what about you, John?
I think I'd echo a lot of what Karl said. I think that the simplest answer is to go back to that why. Why were you doing it in the first place, and has it addressed that need? However, I guess the kind of purist in me, the person that really cares about evaluation and what you're doing, I would definitely pick up on what Karl said in terms of, so at Pro Bono Economics, we know a lot of the reason why people come to us is because it helps them with their fundraising. Because if they've got some excellent report which helps demonstrate their wider social impact, that helps them to raise more funds. Now, that's fine. That is a very legitimate reason to be worrying about this and to be doing it. But what would we really love people to be doing this? We don't want it to be a report that gets used in some fundraising materials and then put on a shelf. We want it to really drive decisions within the organization. And I feel like that is kind of ultimately where you want it to get to. And I feel like that is, as I say, the kind of purist perspective with me would like charities to be using evaluation work to drive those decisions, either to prioritize decisions or to kind of really build it in so that when you're innovating, when you're changing processes, you're really measuring the impact that's having and seeing the incremental improvement. And fundamentally, that's because the issues that the charity sector works on are some of the most important social issues in the UK. They are really fundamentally important to helping us to make a better society. And the more we can drive up effectiveness as doing that as a sector, then that means we're tackling more of these issues. We're doing better. We're getting a bigger kind of return on the money that's going into the sector, and we're solving more of those problems. And I always think, if you look at things like the success rates on addressing mental health issues amongst children, even the very best efforts at the moment, actually the success rates are always kind of worryingly low for children that have diagnosed mental health conditions. That worries me. I've got kids. If my kids develop mental health issues, knowing that I've got maybe a 50-50 chance of them having those mental health issues solved through the kind of best available support at the moment is terrifying. I would love it to be in a position where, when I'm looking at my grandkids, hopefully in many, many years' time, that actually they've got a much better chance of having either never getting a mental health condition in the first place or having that mental health condition solved. And that's ultimately, I guess, what I would love to see and what I'd love to see out of impact measurement is driving up that effectiveness of the interventions we do, because what charities works on really does matter so much.
Brilliant. Thank you, John. And last but not least, Emily.
Absolutely. I agree entirely with both Karl and John, and would, I mean, the way I think about it is I think of it as the success measure here is both external and internal. And external is exactly what John's talking about, is are we being effective? You know, are we achieving the most we can for the beneficiaries or the individuals that we are here to support? Because it is both our moral, it's our moral duty. That's what we were set up to do, all of us as charities, is to effect positive change for this or that or the other group in need. It's our moral duty to be as effective as we can with limited resource. And I have to say that over my career as an evaluation and social evaluation consultant and social researcher, it's one of those red rag to a bull kind of issues for me. Is I think the pounds and pence that go into these services for people who are really in need, they're such a precious resource, and it's beholden on us to do everything we can to spend those precious pounds and pence as effectively as we can. And the best way to do that is to have rigorous evaluation that tells us whether that intervention, that service delivery, that model is actually affecting positive change. And if not, then we need to revise it so that we can use those pounds and pence in the most effective way possible. Because 50-50 in children's mental health isn't the kind of return on investment that we'd really like to see. That's not much better than chance. So that's at the external side. Internally, the way I see evaluation and impact as the success of that is helping organizations understand what they do and to do it better. And I mean, you can see that there's a link between the internal and the external. However, one is about supporting those positive conversations. And I mean, I do have a slight joke that, being an evaluation consultant bleeds into management consultancy, bleeds into therapy. And, there's definitely an element to which you're asking people to have occasionally difficult conversations, or to grapple with difficult questions of change and purpose and philosophy. And so having an evaluation process in place, that one of the success elements for me is to be able to have those conversations productively, rather than to bring that structure to them, so that a really positive end result is shared amongst the senior leadership team. And so that for me is definitely part of the success that I'm hoping to bring, and that structure to bring into Glasspool.
I think I have no doubt on that at all. I think that's a wonderful segue to end the session. It has been absolutely brilliant, I have to say, from somebody who's not particularly well informed on this subject. I'd just like to thank John, Karl, and Emily for their contribution today. It has been absolutely brilliant. And if anybody's got any questions, we'll put up their contact details, because I'm sure they'll be very happy to answer any further questions, or if you want to explore this on a bit, or even need in use of their services. Because except for Emily, of course, who's working for Glasspool. Anyway, I was just trying to think about what my key takeaways from this session has been. Definitely a challenge assumptions. Ask yourself the question of why you are gathering data and doing something. But I think has been clearly demonstrated today, there is no doubt about it, going down the road, however light it might be, of doing some impact measurement will make you a much better informed decision, both externally and internally. It will help very much so around the fundraising, which then allows you to do more. But I also take John's point about actually the ultimate gain or objective for this is definitely around looking to how we can be more effective for the beneficiaries that we serve. So thank you very much.